Hi everyone, welcome to part 3 of our Future Proof Your Diabetes workshop. And we're really excited about this particular section because we're going to be discussing technology and emerging new therapies.
So initially we're going to talk about monitoring, and there's some really exciting developments in monitoring blood sugars, and there's a lot of technology to help us now with not only monitoring blood glucose level, blood sugar, but also in determining dosing of insulin and what foods to eat and when to eat them. And it's really getting quite exciting, and it's really empowering the individual, I think, to be able to live with their diabetes without it adversely affecting their life or their lifestyle.
So it kind of shows you what your diabetes looks like, not fitting into someone else's box of what diabetes should look like, but it's just another tool that we have to personalize your treatment.
Exactly. And look, there's so many apps now available on your smartphones and smart tablets that we're not going to list them. But it really is worth having a look, doing a search online, a search through the app stores to see what you can find. But there's some really exciting app technology available.
Fantastic. And so I think the next thing that we want to discuss is different options for monitoring your blood glucose or your blood sugar. And so did you want to discuss first the importance of monitoring?
Yeah, so obviously if we're trying to make a positive change in health outcomes, the level of blood glucose is really, really important. So we know that blood glucose levels that are really in the range that we would see outside of diabetes, so in someone without diabetes, are the blood sugar or blood glucose levels that we're aiming for, because we know if we can get blood sugars or blood glucose into that level we see in people without diabetes, that they're going to have less health problems down the track. So less kidney problems, less eye problems, less vascular, heart, blood vessel problems, and less nerve problems, less complications overall. So we do really focus on trying to help people to get their blood sugars into a range that we see in people without diabetes. We don't want it too low. So the other thing we've realised in recent times is that blood sugars that are too low are actually very dangerous. So if you think about that, if you have a low blood sugar, and in Australian terminology we use a blood sugar of less than 4, in America the equivalent is less than 3.8, but the deciliters are different. But in those lower blood sugar regions or lower blood glucose regions, unfortunately there is a stress response associated with that, and people will understand that if you've ever had a low blood sugar.
Absolutely.
You feel your heart rate increasing, there can be sweating, there can be nausea, altered ability to concentrate, and obviously in the worst form there will be an unconscious collapse, perhaps a coma. And we know that these episodes of lower blood glucose are very damaging over the long term. So now we're really trying to prevent people from having lower blood glucose levels, but we really would like them to be very much in a non-diabetes range if possible.
And what we're finding too is that with some of the new methods of monitoring that we have available to us, is we're able to really go beyond those finger pricks during the day. We're usually really, really great at monitoring that 12 hours of daytime. But often what we find is missing is that 12 hours overnight, and that's where some of the extended hypos or low blood sugars can happen. And it's important to monitor, adjust treatment, and watch for those when we can.
Yeah, and I think also too, it's a very busy world that we live in, isn't it, Laura? And if you've got a really busy job, it may actually be incredibly difficult for you to stop and measure a blood glucose level. And we're acutely aware of this. So the technology companies supporting people with diabetes have gone to great lengths to develop a whole lot of technology to support people in not having to actually stop what they do in order to check a blood glucose. So Laura's going to tell us about a really exciting new development in this area.
Yeah. So one of the new flash glucose monitors that are available in Australia is called the Libre. And so what it is, it's a sensor that you insert onto your arm, and it's inserted, the filament, it's a Teflon enzyme-coated filament that's inserted with a needle that's removed immediately, and you end up with kind of a white sensor that sticks on via adhesive to your skin.
So the needle's gone, but there's still a little piece of tubing, tiny little, filament, tiny little tube,
Yeah, and that's coated with an enzyme, and as that sits on your skin, the enzyme is underneath in the kind of the fluid of your fat, and what it does, that enzyme interacts with that fluid, and it can calculate what your blood glucose or your blood sugar is. And this sensor can be worn for 14 days at a time. It can get wet, you can be splashed with water, you can shower. What they have is 2 ways to read this sensor. You can do it now through an app on your phone. That's called the Libre app. You can get that from any app store. Or there's a reader that goes with it as well. And it's done by Bluetooth. This sensor holds 8 hours of data, so every time you scan, either with your phone or with the reader, it'll dump that information onto that device, and then the 8 hours will start again.
And that's where the word flash comes from, isn't it,
Yes,
Laura?
yes.
So when you swipe your phone or your monitor over the sensor, that's called a flash.
So this is a great option. You can wear it for 2 weeks at a time. A few of my patients wear it throughout the year. Some just do it for spot monitoring when you need it. So it's a very flexible way to monitor your blood glucose or your blood sugar. The other great thing that Merryn and I really like to use this for is to monitor for those overnight or daytime low blood sugars that we might have missed, or that you might not get the same kind of awareness for. And sometimes the Libre can pick this up if it's there.
And at the moment, there is some expense associated with this particular monitoring device. And so for people who find it a little bit expensive, they may well, as Laura said, be just using it intermittently. So if they feel like their blood sugar or blood glucose control or levels are not quite where they want them to be, but they're not really sure how to make adjustments, and the same with the healthcare providers, if they think, we need a bit more information, they may well just put on one Libre, say, for a couple of weeks to get that information, and then the person may well return to finger pricking. We're trying to lobby very hard, aren't we?
Very hard. And Diabetes Australia, as well, particularly in this country, is working very hard to lobby the government to get this subsidized for everyone who's on insulin. And the other thing too, I'll just add, is there's lots of different reasons why you might just want the Libre because you want it. You might want to not prick your finger while you're on holidays. There's a few reasons, and like Merryn had said at the start, all of these therapies are just another avenue to give you freedom within your diabetes.
That's right. And then the other device that we should mention here is the continuous glucose monitoring system, or CGMS or CGM. So Laura, maybe you could talk about that.
It's through enzymes again, and it's inserted through a needle that has a little filament that stays in your skin. These are typically worn in your abdomen, although patients can wear it in different areas, and it can tell us what your blood sugar would then be.
Okay. And those ones, how long do they stay on for?
7 days.
Okay. And then is there any way of checking the blood sugar while or blood glucose while that's on?
And that depends on each sensor. So some communicate if you have an insulin pump directly to your insulin pump. Some also can communicate to your phone, and some also have a receiver device that they use to communicate what your blood glucose would be at the time. Most of the CGMs that we have on the market at the moment require calibration. So you do have to input what your blood sugar would be, blood glucose would be, for the algorithm to work on the CGM.
Yeah, because it's measuring, remember, the glucose level in the tissue, not exactly in the bloodstream. So there is a slight difference, and it does correct for that, doesn't it?
And so how we kind of describe it, and you can tell me if you do something different, but we kind of talk about being on a roller coaster. So your blood glucose will always be the head of the cart, or the train, I guess, on the roller coaster, and then your interstitial fluid will be about 3 carts behind, and it's all getting to the same place. It's just if you have a fall or if you have a rise, then that interstitial fluid is just going to be a little bit behind, but it all gets to the same place.
And the interstitial fluid is the tissue fluid.
The fluid, sorry, in your tissue that you're entering the CGM into. So what we do recommend, I have a few rules usually with my patients when they start to go on this continuous monitoring system, whether it's flash or CGM, is that when in doubt, get your meter out. These are technologies, they do have limits, but if you have a symptom or if you feel that how you are feeling within yourself does not match the level that it's reading, then you need to get your meter out. Or if you do have a low blood sugar on some of the systems, I do recommend that you do verify that with a blood glucose.
Okay, great, fantastic. So that's really exciting in the monitoring space. And what about the delivery space? So I think there's a lot of really
for insulin delivery.
Yeah.
So you might be able to speak more on some of the emerging therapies, but at the moment, we of course have insulin pumps, which Merryn can talk about in more detail how this therapy kind of works. But we also have what's called a Vigo that's just been released in Australia. And it might be called something different depending on what country you're watching this from. But it's actually an insulin patch that you can wear on your legs, your abdomen, or your arm. And depending on your weight, and this is something that you would discuss with your healthcare provider, it releases a certain amount of basal insulin. And so if you remember in part 2 when we're discussing what the different kinds of insulin were for, the rapid acting insulin, so insulin Lispro or insulin aspart, and please refer back to the list of medication insulins to see the trade name for these. It releases it slowly as a basal rate. And these patches, you are able to bolus with them. So to give an extra bit of insulin with your food. And each click is 2 units. And how many times you click is tailored to you through your healthcare provider.
That's so exciting, isn't it?
Yes, it's very exciting.
Yeah. And so just on that, so we've got this patch or the Vigo. There's also a patch coming. It's not here yet, but it will be available, I'm hoping, within the next 5 years. And it is a similar system. It's loaded with insulin, preloaded with insulin, and the patch will be worn and will be able to monitor. It's got these tiny little nanoparticle filaments or little tiny, I don't want to say needles because they're not really needles, that will measure interstitial or tissue glucose and release insulin based on what glucose they're measuring, and that's called a smart patch. And there's a smart injectable insulin formulation that's quite similar to that, and again that really should be available in the near future, where you will inject the insulin and that insulin formulation will remain in the body until it's needed. So when the blood glucose goes above a certain level, and I understand that they're targeting around 6, I think, initially, when the blood glucose reaches that level, then this insulin will become active and start to work. And then when the blood glucose goes below a certain threshold, then it will stop acting. So these are the smart insulins. And it's worth mentioning too here inhaled insulin. So there are some people with severe needle phobias or other conditions that prevent them from injecting insulin. And so there's one formulation available at the moment called Alfreza, which is an inhaled insulin. So that is available in very specific circumstances. And Laura and I were talking before about the fact that there may well be some oral insulin preparations available in future as well, but just not yet with those preparations. So probably moving on to the insulin pumps.
Yes.
Again, this is a really exciting area, and just the basic philosophy, if you like, behind an insulin pump is that it's loaded with rapid acting or shorter acting insulin, but it is given continuously. So your specialist diabetes team will assist in individualizing those pump parameters. So it's a mini computer really, and we program it based on the individual's insulin needs, and provide what we call a background or basal insulin rate profile. So everyone will have their own basal rate of insulin being continuously given through the skin into the tissues. And then if you eat, obviously, then you require that bolus insulin. So with the current and previous pumps, you have told the pump exactly what you're eating. So people learn how to calculate the amount of carbohydrate, and in future, again, they probably will be adding in fats and proteins too. But we've kind of been concentrating on carbohydrate or starch. And then you just tell your pump literally how many grams of carbohydrate or starch you've eaten, and the pump has been pre-programmed to know how much insulin to give you for an amount of carbohydrate. And it can also work out as well when you tell it your blood sugar or your blood glucose, if you need extra insulin to correct that down, or if you need less insulin to bring it up a little bit. So
and it can also deliver your boluses in different ways depending on the different foods you eat. So it can give you a little bit now and a little bit more later. It can keep track of how much insulin you have on board. So if you have something extra you didn't plan, it's another way to give you freedom. Pumps are typically used in type 1 diabetes, but we can use it in type 2 diabetes as well.
Yeah, so in Australia we've been using pumps in type 2 diabetes a lot more in recent years. And the other nice thing about a pump is if you are sick, before pumps, if you were injecting insulin, we would ask you to increase your insulin doses, and we call that sick day dosing if you're unwell. But in a pump, you can actually pre-program it to have a particular, what we call a temporary basal or a pattern even, its own setting for sick day dosing. So we can program in all of these really, really helpful additional tools to really, empower you and improve your diabetes treatment.
And what's really exciting, especially here in Australia, I know in Europe and in the States, some of these therapies have been released for a long time, but we're getting more pump options, and some of these pumps combined with continuous glucose monitoring can help detect, predict, and alter your insulin administration through your pumps to help avoid or to stop insulin production if you're having a low blood sugar. And what's happening now, which is very exciting, is that we're now able to have pumps through continuous glucose monitoring and that communication that can help predict and adjust for high glucose levels. So this is often referred to as closed loop therapy, and is available in Europe and the States at the moment. But hopefully in the next coming 6 to 12 months will be available in Australia.
That's right. So essentially, that's where the glucose monitoring device is talking to the pump and telling it how much insulin a person needs. So we're really excited about this because we think it's absolutely going to revolutionize the ability to keep the blood sugar in that kind of band that you want it to be in, and to hopefully prevent the blood sugar from going too high or too low. And as Laura mentioned, a lot of them have got alarms and safety devices built into them.
Yes.
To really ensure that your health outcomes and your diabetes is going to be optimized.
Fantastic.
So I think there's really exciting things happening in the diabetes treatment space at the moment. And for a number of decades now, scientists all over the world have really been searching for the holy grail in diabetes treatment, and that really is a cure. And there are some really fascinating and really exciting developments in stem cell therapy and in gene therapy. And Laura and I are going to talk about those in another workshop. But these are pretty close. They're the closest I think I've seen them in my 27, 28 years of medicine. And I'm really excited that that may well be on the cards in future.
Yes.
So thank you so much for joining us for this part 3
of Future Proof Your Diabetes workshop.
And we'll look forward to seeing you in the next video.
Thank you so much.